Hello and welcome to this webinar, Talking to Patients About Alcohol. My name is Jeff McComb, a postdoctoral researcher at UCD School of Medicine, Primary Care Research Group. We would like to thank two sources of funding which helped us to develop this webinar. We would like to thank Ireland's National Forum for Teaching and Learning, who funded the ePrepp project, and we would like to thank the European Commission, who funded the Healthcare Europe project. This webinar has been developed by a multidisciplinary group of colleagues from UCD School of Medicine, the Mater Misericordiae Hospital in Dublin, and Community Response in Dublin. During this webinar, we would like you to learn why addressing problem alcohol use is important and how to identify and help patients address this issue. Let's remind ourselves about some of the key facts about alcohol. Alcohol is the third leading cause of death and disability in developed countries. In Ireland, 30% of men and 22% of women consume more than the recommended weekly limits for alcohol. Expert consensus suggests identification and treatment for problem alcohol use is important. Therefore, it is important for all healthcare professionals to be able to discuss alcohol use with their patients. So let us consider a patient we might encounter in our clinics. Luca attends his family physician each week for methadone treatment. During a regular review, the doctor is concerned that Luca may have been drinking. Please take 30 seconds to consider how you would initiate a discussion around alcohol use with Luca and how you would establish whether Luca's alcohol use is problematic. The following video clip illustrates how these questions should be addressed in practice.
Then, Mark, and just keep up what you're doing really well. Actually, whilst I have you here, Mark, would you mind me asking you a few questions about your alcohol consumption? We're screening patients who are on methadone for the use of alcohol, because alcohol and methadone can be quite a dangerous combination.
No, fire away.
Right, how often do you have a drink containing alcohol? Would it be never, monthly or less, 2 to 4 times a month, 2 to 3 times a week, or 4 or more times a week?
About 2 to 3 times a week, I'd say.
Okay. And how many standard drinks containing alcohol do you have on a typical day when you are drinking? Would it be none to 2, 3 to 4, 5 to 6, 7 to 9, or 10 or more?
What's a standard drink?
Well, it depends on a number of factors, really, including the type of alcohol that it is, type of drink, or indeed the size of the bottle or the can. So, for example, here, a large can of cider is 2, and a small glass of wine is 1.
What would 6 large cans of cider be?
Approximately 12. 12? Okay. And how often do you have 6 or more drinks on any one occasion? Would it be never, less than monthly, weekly, daily, or almost daily?
About 3 times a week.
Mark, your answers to those questions raise a few causes for concern. You've scored 10, which indicate we really should do the full questionnaire. Would that be all right with you?
Okay.
Okay. Thanks again, Mark. And look, if it's okay with you, we can explore this a bit further, and it should only take less than 10 minutes, and I think it really will be helpful for you.
Empirical evidence suggests biological markers may be useful to confirm self-reported problem alcohol use, but are not recommended as a screening measure in clinical settings due to poor sensitivity. And clinical markers, when used alone, can result in up to 98% of hazardous and harmful drinkers going undetected. So an effective instrument to identify people with hazardous and harmful patterns of alcohol consumption is the Alcohol Use Disorders Identification Test. This was developed by the World Health Organization as a simple method of screening for excessive drinking and to assist in brief assessment. It also provides a framework for intervention to help hazardous and harmful drinkers reduce or cease alcohol consumption and thereby avoid the harmful consequences of their drinking. A validated modified version of the full audit questionnaire is the Audit C, which uses the first 3 questions of the full audit to identify problem alcohol use. A score of 5 or more for men or 4 or more for women on the Audit C indicates the need for a more detailed assessment of a person's drinking using the full audit questionnaire. When evaluating a person's alcohol consumption, 1 standard drink equals a half a pint of lager or 1 pub measure of spirits or a small glass of wine. When interpreting a person's score on the full audit, a score of 0 to 7 indicates low risk use. A score of 8 to 15 indicates at-risk use, and the clinician should provide a brief intervention to include advice on reducing hazardous drinking. A score of 16 to 19 indicates high-risk use, and the clinician should provide a brief and/or extended intervention with possible referral to treatment. A score of 20 to 40 indicates very high risk and a probable substance use disorder, and the clinician should refer to a specialist. So let's return to the case of Luca. You identify that Luca is drinking heavily and meets the criteria for harmful alcohol use. Please take 30 seconds to identify what you might do to help Luca to address this issue. The guidelines suggest you should conduct a brief intervention with Luca involving structured advice about his alcohol consumption. Brief interventions are well suited to primary care as due to their feasibility they can be delivered in general settings by non-specialist staff in a short period of time, and they can also be delivered to patients not actively seeking treatment. During the brief intervention, it is important to evaluate the person's readiness to change. After initiating a discussion about the person's alcohol consumption, you can assess what stage they are at in the stages of change model by using the readiness to change ruler. The following video clip illustrates how to discuss the audit score with the patient, assess their readiness to change, and provide structured advice about their alcohol consumption.
Firstly, I'd like to say well done for sticking to the methadone treatment. I believe you're doing really well.
Yeah, clean a couple of months now.
Excellent. Well done. And how are you finding it?
Well, to be honest, I'm struggling a little bit. I've managed to avoid the heroin, but I'm definitely taking a lot more ease. And I've been late to collect my meth a few times as well. And sometimes after I've been drinking, I can't remember what happened the night before. Especially if I go to a party. You see, that's where I get the ease.
Well, look, thanks for your openness. Look, we need to try and help you get back on track. According to the questionnaire, you drink 3 times a week, and when you do drink, it's about 12 standard drinks.
Yeah, I really wasn't sure what standard drinks were, but I'd have about 6 cans during the week, and then I'd have about 6 more at the weekend.
Do you think yourself that's a lot?
Well, I don't know really. My mates drink a lot more than I do. And I don't go near the spirits nowadays. What do you think?
Well, what concerns me is the amount that you are drinking and the fact that it seems to be causing you to relapse on other drugs. You're also having memory loss as well. As a general population guideline, an adult male shouldn't drink more than 17 standard drinks in a week. And it's much less for an adult woman, by the way. You know, if they want to maintain a good physical health. And in people with a history of addiction, as you have, you need to be even more careful. By the way, look, as you're currently doing, and well done, you should try and have several days where you don't drink at all. In your case, you're taking approximately 36 standard drinks in a week, which is close to causing physical harm. The hazardous level is 40, which is set by the Department of Health. And as well as that, it's interfering with your overall recovery.
All of this is new to me, and I do hate taking ease.
Yeah. I wonder if you're substituting the ease for alcohol, though. And yes, the low risk limits are a lot less than what people think. Look, you should continue to follow the patterns which you are doing at the minute, but the question here is to reduce the amount that you are drinking on those occasions. If you're consistently drinking above the recommended weekly limits, look, there are all sorts of worries about your health down the road. Excessive alcohol use is it's associated with everything from anxiety to depression and relationship problems and impotence even.
Jesus, that last bit hasn't happened to me yet. Although the girlfriend won't go near me if I come home and there's a smell of drink on me.
Look, there's another number of other ways you can harm yourself as well. I mean, it can make your blood pressure go up, you can have an irregular heartbeat. As well as that, it can cause awful damage to your liver and pancreas. It can also make you moody and irritable the next day. Look, like I said, the context is you already have an existing addiction, which makes you even more likely and more vulnerable to an alcohol-related harm.
Okay, I get that.
All right, well look, there's no need to panic about it just yet. I know in your case so far you're pretty healthy and there's nothing to worry about health-wise at the moment. Well, apart from your memory loss. Is drinking causing any other problems in your life? I note on your full screen here that you do say you feel a little bit guilty about your drinking.
Yeah. My girlfriend's been getting on my case big time. She says I'm a different person after I've been drinking. And with the new baby in the house, I probably should be helping out more than I am. I am crankier with her, with the drinking me. And as I said, she won't have sex with me if I've been drinking.
So, there are other consequences to your drinking. Do you think you might consider reducing your intake?
Yeah, I think I better after hearing all that. But you're not telling me to stop completely, right? Just to reduce the drink. I hadn't thought about the connection between drinking and taking ease. 17 standard drinks. Sure, that's only 2 or 3 cans a day for me, for the week.
Look, I can see you thinking along the right lines. It's really up to yourself. The benefits will be mostly for you, but also for your family too. Look, can I ask on a scale of 1 to 10 how important it is for you to, how important it is for you to change the pattern of drinking? 1 being, I'm not ready to change at all, and 10 is, I really want to change.
About a 6, I'd say, after today's chat. I'm definitely more willing than I was before we had this meeting. But it's a huge part of what I do with the lads.
And again, on a scale of 1 to 10, how confident are you that you can change? Again, 1 being, I'm not at all confident, and 10 meaning, I am confident I can do this.
About a 5, I'd say.
Well, that's really good. So it is important to you, but we need to boost your confidence and give you some tips to help you succeed. Lots of people have managed such changes in this practice. I mean, and it is doable. But it's something you'll have to take charge of yourself, though.
I think I can make some good changes.
Look, and listen, you've managed to keep yourself off heroin as well. I mean, that's a massive positive. So there's no reason why you can't control your drink. We'll give you a lot of support, but it takes a lot of effort too, and a lot of focus on your part. It's a bit easier than you think, though. I mean, most of it is just plain habit.
I suppose. And another thing I just thought about, sometimes after I drink, I don't sleep that well.
Well, that's common. So perhaps in a few weeks we might find that we've got your sleeping patterns under control as well. So what kind of things might you do to reduce your intake?
I could stop buying cans on the way back from the post office on a Thursday, as well as physical exercise. I know the lads are setting up a footy team on a Tuesday night. I used to be good at that as a young fella, and it would help with my fitness as well. If I was back playing football, I wouldn't be drinking and I wouldn't be taking ease either. I'm less likely to relapse on the yokes if I start the drinking out and get it under control.
All good stuff. And you could drink less strong cider too, or maybe even change to a lower strength beer, and at least half the amount you do consume on each occasion. You could also drink more water. It might be an idea to try and stop completely for a few weeks. Do you think you could completely give it up for a few weeks?
I don't know. I could try. Could I not just reduce it down to 1 or 2 days a week? That's all I'm willing to try at the moment.
Yes, if we make the changes we've discussed. The idea would be to try to drink a good bit less than the 17 standard drinks a week. Look, which would mean, for example, 3 cans a day, maximum twice a week. That would be a massive improvement. Look, if you're unable to stick to that, we might be able to review it all again down the line. I'm not so sure you should be going to those parties either. Either way, I want to set up an appointment for a couple of weeks just to see how things are going. Is that all okay with you?
Yeah.
Listen, thanks for your openness, and I am confident you can do this.
Okay, sound, Doc. Thanks.
To help as a guide when conducting a brief intervention, you can use the frames outline. So firstly, provide feedback on risk for alcohol problems. Secondly, highlight that the person is responsible for change. Thirdly, provide advice on how to reduce alcohol consumption. Then talk to the person about different options for change. And throughout the intervention, be warm, reflective and understanding in approach. And finally, always encourage belief about changing behaviour. So you should now have an understanding of why addressing problem alcohol use is important and be able to identify and help patients address this issue. And you can find further resources for addressing problem alcohol use which are available on the drugs.ie website. And I'd just like to thank you for taking the time to listen to this webinar.